Hey everyone, my name is Michaela Peters, and for my passion project, I chose workplace violence prevention. This is a topic that I am very vocal on in my professional career as a clinical supervisor, and I felt that it would be appropriate to express my passion through this project. So to get started, what is workplace violence? Workplace violence could be any form of physical assault. It could be verbal abuse or harassment, or any kind of threats that take place at the workplace. And in healthcare, we could see that through patients or our coworkers or physicians, um, or family members at the bedside as well. So why am I passionate about workplace violence prevention? I have been a nurse for 8 years, and prior to that, I worked in healthcare as a CNA. And in my years of experience, I have seen and been victim of multiple forms of workplace violence. Personally, I've been called names, we've been cursed at, and then even recently we've had a coworker where a patient had attempted to kill the coworker. And so I feel like it's a important topic that needs to be discussed and needs to bring awareness to the severity. And then also with that, we've had, as a clinical supervisor, I've had multiple coworkers come up to me and voice their concerns, and I feel like in my role it gives me the opportunity to bring awareness to it and hopefully lead some change to decrease the amount of workplace violence that we see. And then I find that it's hard to expect our coworkers or even ourselves to put forth all of the care and the energy it takes, physically and mentally to take care of patients when nurses feel like no one's supporting them and caring for their safety and their well-being while at work. So what can we do about it? One thing that we encourage our nurses to do is to respectfully set boundaries when issues arise about what expectations are and what acceptable behaviors are. Remind them that we speak to each other with respect, and that physical acts of violence would not be tolerated. And then if needed, we would encourage them to utilize security for additional assistance. Also, patients or family members in general that we know are prone to these behaviors, we would encourage them to use like a buddy system so that they wouldn't go into the rooms alone, and they would feel supported. And another way that we can bring more awareness is to encourage our teammates and ourselves to report all acts of workplace violence, no matter how big or small that it seems. We can't expect a problem to get fixed if we're not being honest and letting our leadership know how we feel and what we experience. I know with our facility we have a QR code that we can scan, and it allows us to report workplace violence anonymously, so that it reduces the fear of retaliation if we were to report like a coworker. So that's just small things that we can do to prevent or hopefully reduce workplace violence. When looking at the future of nursing 2020-2030, I felt that workplace violence is most fitting for the recommendation of supporting the health and professional well-being of nurses. Workplace violence can lead to physical injuries. It can increase the nursing burnout, which is already an issue coming through COVID. It can decrease the job satisfaction, just constantly coming into work knowing that you could be potentially physically or mentally abused, and then the residual effects of the anxiety and the potential PTSD that also comes with that. So I feel like workplace violence is a significant or has a significant impact on the well-being of nurses and their happiness in their careers. Some significant statistics that I found while doing my research was that healthcare workers have the highest rate of violence and assault among other occupations, and within the healthcare field, specifically nurses and CNAs have the highest rate of the acts of violence towards them. And then in 2018, the healthcare workers accounted for 73% of all of the non-fatal workplace injuries. So that's a significant amount of injuries. And then I had mentioned previously in a different slide about how we should report all of the acts of violence that we experience, and I found that only 20 to 60% of workplace violent acts are truly reported. So knowing that there are so many healthcare workers that account for all of these injuries, just knowing that that's only a portion of the actual reports, it just is very eye-opening to how severe the issue truly is. And then 2 nurses every hour are assaulted in an acute care setting. So I just found all of these statistics to be very alarming and concerning.